We spend a whole lot of time on this video talking about your children, but we want to spend a little time talking about you. Being a parent is an enormous change in your life. It's remarkably rewarding. It's a fantastic experience, but it does offer some changes in your life. So I want to talk about 6 things that might be helpful as far as parenting, sort of tips to help you with your parenting challenges that come along with this new baby. One of the things that can absolutely happen to women after, sometimes even late in their, right before giving birth, but definitely postpartum, is what's called postpartum depression. Now, this is a real disorder. This is the real deal. This is an honest to goodness, absolutely can happen. It doesn't mean there's something wrong with you. It's just part of what can happen to actually 1 in 8 women who has a baby. So part of postpartum depression, it's a constellation of symptoms that occurs in women. 1 in 8 women in the postpartum period will get this. So that means that 12 to 13% of women walking around out there with babies at home have this problem. If you have the symptoms, you are not alone. Now, there are a lot of theories as to why does this happen? Why do women in the postpartum period get this? And the theories include things like you're just tired all the time. You're chronically lacking of sleep. You have this new little person that you're having to get up over and over and over again to feed and take care of, and cries and needs you. So that's one of the things, chronic lack of sleep. You're overwhelmed with work and what it takes to take care of a new baby. It is somewhat overwhelming. You have doubts about whether you can even do this. Am I a good mom? Am I doing this right? Can I do this? The stress from changes. Your life is never the same after you've had a baby, and the stress of the changes that happen both at home and at work are remarkable. You are no longer the same person. You're no longer, you, the individual person. You are you, the mom, as well. So your life is changed completely from now and evermore because of having a child, and that may be some sort of contributor to postpartum depression. Clearly, your body changes when you have a baby, and some women feel less attractive after they've had a baby, and that may factor in as well. And you clearly have less free time than you had before. You have this little person who needs you, you're stretched pretty thin. So all of these factors may be part of what contributes to developing the true problem of postpartum depression.
I'm just thinking as you're listing these, check, check, check. This is so common. For every woman who has a baby is going to feel some or all of these things. It's just to what degree and how is it affecting you?
When does it go from just what every woman feels to, no, this is something
this is a real
that's
problem
more
we need
serious.
help. Exactly. Now, some women are going to be more prone to true postpartum depression. So if you have a family history, or you yourself have a family history, or you yourself have some type of mental illness or history of depression, it's going to put you more at risk for something like postpartum depression. If you lack any type of support, there's a phrase that it takes a village to raise a child. If you don't have that village around you, if you don't have family and friends, maybe you've moved to a new city and it's just you and your partner and now this new baby and you're really in isolation, you're much more at risk for postpartum depression. If you have any anxiety or negative feelings about the pregnancy, maybe you didn't want to be pregnant in the first place, and now you've got this newborn to take care of, and you didn't want to be pregnant to begin with, that's going to put you more at risk for postpartum depression. If you had any type of problems with this pregnancy or with the birth or previous pregnancies, again, much more at risk. If you're dealing with marriage or financial problems at the same time, if you had some stressful life event, maybe you moved to a new city or you took on a new job at the same time that you had this baby, much more at risk. Or if you have any type of substance abuse, if you're addicted to either prescription pills or alcohol, you're going to be much more at risk for postpartum depression.
Now, having those, I feel tired or I feel unattractive every once in a while is not postpartum depression. That's just normal. Everyone feels some of those at some time. It becomes a problem when you have a predominance of a lot of those over a period of time. So if for more than 2 weeks you have a predominance of the following kinds of feelings. You feel very moody, you feel very sad, you feel overwhelmed and just hopeless. You cry and you cry and you cry. You're just having lots of trouble keeping from crying. Or you just have no motivation. You want to pull the sheet over your head and not get out of bed. Not just once, but again, this is on an ongoing basis. You can't focus, you can't decide things, you can't remember things. You just feel worthless and guilty, and nothing that you used to love makes you happy anymore. If you don't talk to your friends and family anymore, you withdraw from them, or you have physical symptoms like headaches or aches and pains that just don't go away. If in that list of things you have several too many of them, for 2 weeks or more, that is something you need to talk to your doctor about. Again, 1 in 8 women after they have a baby have this. It is not uncommon. It is not a mark of shame. There is nothing that is wrong with you. It is something that is a disorder that can be dealt with and can be addressed. But don't suffer with it. It's not necessary.
Exactly, exactly. So below are some tips. We're going to talk a little bit about some tips that might help in regard to if you feel like you may have some postpartum depression or some of these symptoms for a longer period of time. The first is get as much sleep as possible. Sleep, exhaustion, not getting enough rest, that's going to make your whole world, color your whole world in a kind of a negative way. The teaching is if your baby's sleeping, you ought to be sleeping. Your baby's going to be on a sleep-awake cycle. You need to sleep when your baby is sleeping. Don't try to do too much. Don't be perfect. Don't aim for perfection. You're making this up as you go along. Just take care of your baby.
Don't compare yourself to the person down the street who looks like the perfect mom. That perfect mom may be 1 in 8 that has postpartum depression.
Exactly.
So don't compare yourself to other people.
Ask for help. Ask your friends, ask your family, talk to your partner, tell them what's going on. Let your partner know what you're feeling. Don't make them guess what's going on inside that head of yours. Let them know what's going on. Ask your friends, ask your family for help. Make time to get away from your child. Your whole world is this new baby. You got to act like a grown-up sometimes. Make sure your baby gets well cared for, get a good babysitter, get a friend or a relative to care for your child, but then go out. Make some time for yourself, to visit other adults, to talk to your friends. Don't lose sight of your friends and your family. Discuss your feelings. Again, making sure your partner understands what's going on. Talk with other mothers. Again, 1 in 8 women, you just walk down the street, you're bound to find a mom
Just go to the park with your baby and you'll find at least somebody else.
You're going to find other mothers who have been in the same situation. Just kind of talking about it a lot of times is therapy in itself. Just talking to someone else who's been in your shoes, and also joining a support group. There are specialists, there are therapists that really deal with postpartum depression, and getting together with a group of women who are going through the same thing, meeting with a therapist who's kind of an expert in the field. And you can find these support groups through your local hospital, your pediatrician's office, or even online is a great way of finding support groups.
Just go to an internet search engine and type in postpartum depression and celebrity. And there are several very well-known women who have been very open about their postpartum depression so that everyone can know it happens to everyone, no matter who you are. This is a common problem that is something that can be dealt with as long as you're open about it. Couple things, if you can have some impact on them that will decrease the likelihood of getting postpartum depression, of having this problem occur. If at all possible, having a baby is enough of a major life change. Don't add more to it. Don't change your job. Don't move across the country. Don't buy a new home. It's not a great idea to try to do all those things at once. And you're having babies at a time in your life where those things tend to occur as well. If you have any control, don't do them. But if they do occur, part of having the baby is you moved across the country, you got a new job, and you all bought a new house, well then do what you can to get a support system in place before you ever even get there. Find out where are there groups that you can meet? Do you have family members close by? Are there any friends that are going with you? Whatever you can do to get some sort of support system sort of set up. And just to kind of get down to a bottom line that kind of threads through everything is if you're really frustrated, you're really tired, don't ever take it out on your baby. And even something what seems as minor as just, I'm so tired, I can't stand it, with your baby can cause some damage. So don't shake your baby. Frustration, anger, if you're depressed, none of it. That doesn't go to the baby. Baby's someplace safe. You have lots of places you can go to get support for the troubles that you may be having.